the Medical AI Podcast.
Hello, I'm Dr. Felix Beecher, and this is the Medical AI Podcast, a 30-minute thrill ride of big ideas. We talk to a range of top guests, from industry innovators to scientists to philosophers. This is brought to you by Omdia and Informatech, where I'm the head of healthcare technology. Some studies have estimated that in the US, for example, medical error accounts for as much as 400,000 deaths per year. See, for example, the 2016 BMJ article by Macquarie and Daniel. That makes medical error the third leading cause of death in the US. One of the major sources of medical error is communication problems. A Mayo survey found that only around 42% of patients could name their diagnosis. Only 28% could list all of their medications, and only 14% could identify the drug's most common side effects. Well, today we're going to be exploring whether AI systems could improve communication between patients and healthcare providers. And joining me to discuss this is Matt McBride, CEO of Mend. Matt, a very warm welcome to the podcast.
Yeah, Felix, appreciate that. It's great to be here, and I'm super excited for the conversation today.
That's the spirit. All right. Well, look, could you please introduce yourself and how you came to this area of patient-doctor communication?
Yeah, absolutely. Matt McBride, CEO and co-founder of Mend. Mend is a telemedicine and patient engagement platform, and I know we're going to get into some of that. But I've had throughout my career had various jobs and sort of a focus in healthcare, and of course, everybody on the planet is a patient. Like everybody listening has been a patient or will be. And really just saw an opportunity in healthcare to create, more digital and more frictionless experiences between healthcare organizations and patients. So, basically between you and your doctor, right? How do we enable healthcare organizations to leverage more modern means of communicating and engaging with their patients to ultimately, drive better outcomes and help more people?
Okay. All right. So we're going to be talking about how AI can help patient-doctor communication. What exactly, though, is the problem that you are trying to solve at Mend?
Yeah, so I think, there's sort of two sides of this equation, right? You got the patient side and you have the healthcare organization. Well, ultimately, the healthcare organization is our customer. That's who we sell our software to. And I think they're looking for ways to address patient no-shows, no-show rates across the globe for healthcare average around 23%, which is crazy. 1 in 4 people you put on the schedule are never even going to show up. So there isn't even a chance of a positive outcome there. And then I think there's other problems where we might be helping them with payments or trying to help them automate certain tasks and things of that nature. And then you have the patient end of it, right? And as patients, I think we're looking for convenience and less friction in the healthcare experience, right? We want to have more access and be able to communicate in new and different ways. So as an example, a study from Accenture, 69% of patients want to communicate with their provider through secure email. Usually it's a phone call, right? It's a phone call to get anything done with your doctor. And patients are texting and lots of other industries that are texting with their friends, families, coworkers, all these sorts of things. And, they want to be able to communicate in new ways. And then, we even saw in some other data that 37% of patients might be willing to switch to a new healthcare provider to have some more of these, modern and convenient types of experiences. So I think, patients are kind of demanding it. And then on the healthcare organization side, where a lot of times we're trying to help them, see more patients.
Okay, great. So could you explain why this field is important?
Yeah, absolutely. I think, the more that folks stay engaged in their care, especially with their doctor, right, the more chance there is to stay on top of whatever the issue is, or to discover something early before it becomes an emergency, right? So I think, more and more, payers and research is showing that, if we can catch things early and deal with things early, we can avoid trips to the ER. We can avoid long hospital stays. We can kind of, manage these conditions so that something critical doesn't happen. And so I think what technology can do is it can introduce a little more convenience into the relationship between the patient and the provider. And by introducing a little more convenience, patients engage better, right? And they engage better, they engage more often, and they stay more compliant, they stay more adherent, they don't no-show as many appointments, they have access to talk about their medications, what have you. And all of this just keeps them more engaged in their healthcare on top of anything that's happening, and ultimately can lead to better outcomes and, less emergent type of situations.
Okay, so look, do you have any horror stories? Not necessarily from your personal history, but have you heard of any horror stories that kind of illustrate the problem here?
Well, I mean, we definitely in our line of work, we do encounter folks that are suicidal, right? And they're looking for that access. They're looking for, we're not always involved in the day-to-day care and everything that's sort of happening, but in those cases, those folks, they need help. That's a big deal, right? And having that, being able to have that sort of access or line of communication to get help from your healthcare organization, or for somebody to be able to route you to somewhere where you can get that sort of critical access to care. That's definitely something that we encounter, probably on a more regular type of basis. But I think that's what we're talking about in healthcare, right? Like, what are the horror stories, right? The horror stories are people can die. So it's serious.
Okay, so tell us about your product at Mend and how you think it addresses these kinds of challenges.
Yeah, so we can provide almost a comprehensive digital front door, and it's a little bit more than a digital front door because we can help during the visit and we can help after the visit as well. But we can offer everything from patient self-scheduling, so patients can schedule their own appointments, make changes to their appointments, and provide that level of access to doing all the forms digitally, reminding patients of their appointments through modern means like text and email, handling payments before the visit, after the visit, all just in a frictionless, effortless type of experience. And then we also offer telemedicine. So we can actually facilitate the encounter between the patient and the provider. And what we typically see is, no-show rates that maybe were 20, 30%, you offer telemedicine, now they drop into the single digits, and you see compliance, adherence, all of these things really start to improve. And and organizations are able to help more people. So we really provide all of these different tools to a healthcare organization to give a really comprehensive, modern, frictionless experience between their staff, providers, and the patients.
Now, a lot of the things that you've talked about, like scheduling and providing a digital front door, those could be implemented by standard old-style software. So how does machine learning or other forms of AI help implementing these things?
Yeah, I think, AI, we are going to see touch lots of different aspects of our lives, and especially in healthcare. So just some examples, one of the methods of communication that we offer is secure two-way messaging between your healthcare organization and a patient. So, being able to message them, right? You message everybody in our daily lives. Well, AI might be able to assist in those conversations and, you might have questions about the healthcare organization, about your care, about education, or maybe you want to book an appointment, you need a refill, what have you. Well, with what we're seeing in Chat GPT and being able to understand human language and communicate back in very accurate ways with somebody, there's a lot of access to information that could be automated, to things like telemedicine visits, where maybe we're seeing captioning, translation, sign language, all being enhanced by AI. And then, other aspects, right? AI might be able to do all of the vitals capture through a webcam. We're starting to see those technologies emerge. And, what other ways might it assist a doctor? I think, it's really starting to take off and be a focus within healthcare. And so it'll be really interesting to see how it enhances care in the future.
Sure. Okay. Well, let's just imagine that I'm a patient and I'm about to try and book an appointment with the doctor, and I go onto a website which is somehow managed by your kind of system. Now, what specifically would I see? What would be my experience of using your kind of product?
Yeah. So, for example, let's say you were sort of starting that you had this need to book an appointment, right? Well, if you look at the way things happen today, the way they happen today is you have to call in most cases, and there's not always somebody around to answer the phone, right? They might have the answering service after hours. They might have the answering service during lunch breaks. And so you really don't even have somebody who can book an appointment. So you have kind of to call these very specific times sometimes to book an appointment, where now you could potentially interact with, maybe through secure messaging to get that appointment booked, or you could go through our self-scheduling process. But imagine just to stay on the topic of AI, imagining that AI may be enabled by Chat GPT or something similar to gather up all of the information needed, communicate in a very clear, crisp, human-like way, right? Mm-hmm. Gather all the information from you and then book that appointment. And perhaps you can have access to that now 24/7, 365.
Sure. Okay. We'll come on to Chat GPT in a couple of minutes. But I mean, let me just ask you first, I assume that there are some doctor surgeries out there or hospitals out there that are super early adopters and they already have these kind of systems deployed, right? So could you describe where we're at in healthcare in general in the States? I mean, how far are these kind of systems deployed already?
I think they're early. I've definitely heard about AI in regards to payments. So I think from a billing perspective, there is AI that is making sure that all of the information is accurate so that it can be submitted to insurance for reimbursement and not be denied. So I think there's sort of, I think it's being more widely used from a billing perspective in terms of actually assisting providers, or maybe the patients sort of experiencing AI as part of their care. I think we're early stages here. I haven't, you're starting to see things emerge, and I think people are really starting to work on it. But I'm not sure that AI has really played a role in any of my care or the care of anyone I know yet.
Right. Yes. Okay. Do you think there are any potential ethical problems with the implementation of these kind of systems?
Yeah, absolutely. And I think whenever you even start to talk AI with a healthcare organization, they're all concerned about that as well, right? They don't want, we've seen instances where AI has been biased. It can develop a bias. And I think in a lot of cases, this stuff is being trained with content that humans have produced, and we do, have biases, and we're not perfect. And so that can carry over. And so, as we've talked about it with different healthcare organizations and whatnot, I think, they're always kind of wondering what type of information is going into it, right? Are you putting age, race, religion, or other types of data? Are you leveraging that? Are you putting that into this AI? I think that's where a lot of the concern is. And so I think our approach is to be very careful with that, right? I think if can you train models? Can you leverage this AI without giving it that data to where it could even have some sort of bias? I think that's our kind of approach to it. But I think that's the biggest ethical concern.
It's interesting. Do you know, I have a phrase for this, and it is the comparison to perfection fallacy, because I think what people tend to do is to complain about AI systems being, for example, biased, and also forgetting the fact that humans are all biased, very biased in many ways, right? So what we should actually be doing is comparing them to humans, not to perfection. So this is a kind of, I'm sure I'm not going to persuade everyone with this argument, though.
Yeah, and I mean, at least it's good that we're talking about it now, right? And that people are concerned about it now, because maybe we can create something that has far less biases, which would be great. So.
Also, I think that potentially you can imagine a system which delivers better healthcare on average, but more unequal. Now, is that a good thing or a bad thing? I don't know. I mean, that's a subjective matter, right?
Yeah,
but
it's
an interesting question
for the scientists to study, right, and publish papers on, and definitely going to be studied a lot more in the near future.
Okay, let's talk about a couple of developments I know that you're interested in particular. And one is is ChatGPT, who coincidentally was my previous guest on the podcast. I have to say the experience was pretty weird, because on the one hand, it was brilliant and gave very insightful answers. On the other hand, it was a bit like being stuck in the space module in 2001 and talking to Hal and trying to get the bay doors open, because there was that's kind of I don't know how to describe it. It was that kind of absolute clinical lack of any kind of human charisma, I guess. I mean, but then on the other hand, we know from life that a lot of people are like that too. So anyway, let's talk about ChatGPT. It's causing a big stir at the moment. How do you think that kind of technology could be applied in healthcare in general?
Well, one of here's something maybe you want to try, right? You can actually set the personality of ChatGPT. You may have to interview different personalities.
What, you can do that already? I did not know that. That is really interesting.
Yeah, so that might be really interesting to see. What type of personalities and so you might have a few more Chat GPT guests to invite.
Well, let me just mention on there. I mean, it apologized about 3 or 4 times, probably excessively, but it also told me off for asking a question which it thought was kind of meaningless. So it was at once very stroppy, but also kind of apologetic. It was very strange. So anyway, so let me answer the question again. How do you think the Chat GPT-like technologies could be applied both in the kind of product that you're developing, but also more generally in healthcare?
Yeah, I think I think it can definitely help increase access to care because you might be able to do a lot of valuable things with Chat GPT, like booking appointment or making changes to appointment. Handling paperwork, prescription refills, or other types of routine tasks with a healthcare organization. So, how might it really streamline and speed up the communication between, accessing your provider? I think those are some of the things that we're looking at as more and more healthcare communication probably moves to secure messaging, asynchronous types of communication, like thinking of almost like there's secure email, and how might AI or Chat GPT enhance those conversations. And then I think you could even think of things like maybe giving you more access to educational type of content if you have questions and things of that nature. And so I think there's a lot of other ways it could potentially support a provider as well. But I do. I don't know if you experienced this on your podcast, but I have seen it make things up. So we've started to play around with some of the technology last year, and asking it some questions, asking it to produce some content in a specific area, and it literally, I saw it reference a study that a bank had put out. And then I could not find that study by that bank anywhere. So it is not perfect. And imagine in healthcare, if it just made something up, right? If it just made up a treatment to an issue, like that could be a disaster, right? But if it messed up your appointment booking, maybe that's a little bit more easier to deal with, and that's kind of where we're thinking. But there's definitely it's definitely not perfect yet, and right now it doesn't even have any data from 2022. It's only trained up to 2021, so that's something else that'll have to be fleshed out too.
All right, now another thing that you're interested in, I know, is the concept of remote biosensors through webcams. Now, this is something which coincidentally I have heard from different quarters in the last couple of weeks. So my impression is this is something that is really rapidly emerging. Can you talk a little bit about that?
Yeah, I think it's sort of this concept of a medical device in the cloud. Or if you start to think about, sort of software that's in the cloud that is able to gather information. And I think one of the coolest ones that I've seen is the ability to capture your vitals through a web camera. So, your heart rate, your blood pressure, your heart rate variability, your stress levels, there's what's your sort of risks for depression, based on how your face sort of posture is. And I've seen a lot of other potential vitals that could be captured. And I've used some of the technology with my own web camera in combination with access to other devices, right, where I can sort of see what my heart rate is compared to what it says on the camera. And I think this is definitely an emerging AI technology that we'll see more and more and we won't be so dependent or have to require you to go into a physical location for care just to capture your vitals. Might be able to provide care virtually, right? But still get all of those vitals for you. And so, it varies by country, country by country. I think some countries have already approved this type of technology to be used with patients in healthcare situations. I know in the United States, we have not seen the FDA approve this type of technology for use with patients. It's really only for entertainment purposes today, but it's definitely emerging and definitely, I think, could be the tricorder, right? What the webcam might be able to capture, what a camera might be able to capture, could be the Star Trek tricorder. So it's very cool, very interesting how that's evolving.
It's a fascinating idea. And look, I have to be honest, when I first heard this idea, I just thought it was probably nonsense. And the more I thought about it and did a little bit of reading around it, I've kind of convinced me that the concept is actually pretty interesting, potentially viable. Let me ask you this. You're saying that you're already using this kind of technology on yourself. Does it only, I'm presuming it only works with a pretty high spec webcam. Can you talk to that?
Yeah, I mean, we've definitely, that's kind of what you would assume, right? And I have a 720p webcam that I've been using it on. I've had this webcam for, it's got to be going on, 6-7 years, something like that. It's not the latest and greatest. And I'll move around, right? Like you try moving around, I'll be close to it, be far, like trying to break it, right? And it's pretty cool. It's pretty darn reliable. And even with my old webcam, it works great.
And so what kind of, have you done any, I know this is informal, right? But just informally, what kind of testing have you done on these kind of systems? What kind of biomarkers or metrics have you performed on yourself?
Yeah, so I've gotten my heart rate. The blood pressure is the most impressive one, right? Because to get blood pressure through a webcam in sort of these little changes of blood flow that could be detected through pixels through a webcam, right? And be able to tell blood pressure based off of that. Heart rate variability is another one. Skin age, stress and anxiety levels. So those are some of the ones that I've played with myself. But definitely blood pressure is a big one, right? Every time you go to the doctor's office, they want to check your blood pressure.
Yeah, right.
If you could start doing that through a web camera, it opens up doors for a lot of virtual care.
And so what's the input there? Is it skin tone, or, I mean, you said posture before, but I'm guessing it can't be posture. It must be something like skin tone. But then you'd need to know something about the temperature in the room and the lighting conditions. So I'm still trying to kind of figure out how this might work.
Yeah, I think a lot of it is based off of blood flow that can be detected by sort of watching a certain pixels on your face and kind of seeing how those, like, not really noticeable to the human eye, right? But the camera can kind of focus in on a pixel, detect the slight changes in red in your face, in a certain spot on your face, and then it's able to generate some of this information where maybe like stress index or if you're anxious or depressed might be actually how your face looks at the time. So there's different things it's able to look at, whether it's looking at a little pixel in your face, your whole face, and I've seen as many as 40 different vital signs that could potentially be captured through a web camera. It's pretty impressive stuff.
All right. So at the moment we just have the green shoots of this field popping up from the ground, but this appears to be definitely one to watch for the future. Okay, well, look, I've got one last question for you, Matt, and that is the question that I generally end with, and that is, what is your favorite current example of medical AI not your own?
Yeah, I definitely, I definitely like the webcam vitals, but I think if you look at all of I think one of the things that probably could be done fairly easily and reliably is there is a tremendous amount of medical research and papers and studies out there that a doctor cannot keep up with on their own, right? And so I think the ability for something like a chat GPT or something like that to take all of this information and then almost assist a provider in a co-pilot type of scenario, that could be really interesting. So I think more and more, I think I'm sort of fascinated with this concept of AI as assisting providers, not necessarily taking over care, but maybe assisting them in certain medical imaging scenarios or other types of scenarios. So definitely an emerging, exciting field right now.
Well, Matt, it's been an absolute pleasure talking with you, and thank you very much. When you have developments of your own, then do feel free to come back and talk to us again. I'd be very happy to have you back.
Yeah, absolutely. Appreciate you having me on the show, Felix. This has been amazing.
Fantastic. Thanks so much, Matt. Talk to you again. Bye-bye. Thank you for listening. I'm Felix Beecher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.